We will be using two models as we talk about the articulation and resonance cavities. One model primarily for the osseous structures and the other for the muscles. Starting with the osseous structures, the mandible here is a paired bone with a mental foramen where the trigeminal nerve, cranial nerve 5, passes through. The symphysis menti right here is the point of fusion between these two halves. The angle here that goes upward toward this part of the bone is, which is called the ramus, ends up where the mandible notch separates the condyle process, which articulates with the temporal bone, from the coronoid process, where the muscles of mastication attach. Now, where the condyle process connects with the temporal bone is called the temporal mandibular joint. An impairment here with just a shift of the condyle process will limit the movement of the mandible for speech and cause pain. The maxilla are paired bones that make up the upper jaw, most of the roof of the mouth, the nose, and the upper dental ridge. The hard palate here has an anterior portion that's called the premaxilla, where the nasopalatine nerve and the sphenopalatine artery pass through what's called the incisive foramen right here. The premaxillary suture separates the premaxilla from the palatine process, which itself is divided down the middle by the intermaxillary suture. Any deviation in the palate structure will result in a cleft palate, allowing air to pass through the oral cavity to the nasal cavity during speech, and phonation will result in nasality of non-nasal sounds. The palatine bone is the posterior horizontal plate that's separated from the palatine processes by what's called the transverse palatine suture. It parallels the palatine process of the maxilla. Not pictured here, but this is about where it would be. The vomer is a part of the nasal septum. The vomer is an unpaired bone, and it makes up the posterior inferior part of the bony septum. Now, the nasal septum really are the dividing plates. It's the actual two nasal cavities. The teeth in an adult dental arch should have about 16 on the top and 16 on the bottom, and this model has a full set. Teeth in the upper dental arch are larger than those in the lower dental arch and consist of 4 incisors for cutting, 2 cuspids for tearing, 4 bicuspids, and 6 molars. The tongue, not pictured here, but I'm going to add one, is the most important of all the articulators and is involved in the production of the majority of English phonemes. All of the muscles of the tongue are innervated by cranial nerve 12, the glossopharyngeal nerve. We've got the superior longitudinal, the inferior longitudinal, the genioglossus posterior, the genioglossus anterior, styloglossus, the palatoglossus, and transverse intrinsic and vertical intrinsic. We've already talked about the hard palate, but we need to go back and take a look at the velum because it's very important. The velum itself opens and closes to separate the nasal and oval cavities. Any loss of function will result in possible nasal regurgitation and definitely nasality of non-nasal speech sounds. Innervated by cranial nerve 10, the vagus, and the accessory cranial nerve 11, the pharyngoplexus, the levator veili palatini elevates and retracts the velum. The palatopharyngeal lowers the soft palate and narrows the pharynx. Now we want to go to the zygomatic bone. The zygomatic bone makes up the cheek bone and it articulates with the frontal bone and the frontal process at what's called the frontal process, and the temporal bone at what's called the temporal process, and the maxillae at what's called the maxillary process. The ethmoid bone is the core bone that forms the major central articulation of the cranial and facial skeleton. A portion of it is visible here within the nasal cavity. The sphenoid bone contributes to the cranial structure. It consists of the corpus, here the greater wings, the lesser wings. There's a pterygoid processes, lateral and medial. There are several foraminas where nerves and blood vessels pass through. Medial and the sphenoid bone is the corpus. Medial in the corpus is the pituitary fossa. Okay, the frontal bone here makes up the bony forehead. It articulates with the zygomatic bone here, with the nasal bones here, and provides the supraorbital margin or the superior surface of the eye socket. The parietal bones here are paired bones, and they are untied or separated by what's called the sagittal suture, which runs from the frontal bone all the way back to the occipital bone. Now, the occipital bone right back here is separated from the parietal bone by the lambodial suture and makes up the posterior brain case. Inferiorly is the foramen magnum, which forms the entrance for the spinal cord and the beginning of the medulla oblongata. The temporal bone on the sides here are important for speech pathology and audiology, as the temporal bone houses what's called the mastoid process here, where bone conduction hearing aids assist in hearing by vibrating the mastoid process. It is separated from the parietal bone by what's called the squamosal suture right here. It connects to the zygomatic bone at the zygomatic process right here, and the lower margin includes the roof of the external auditory meatus, or the external conduit to the middle ear. Now, the oral, nasal, and pharyngeal cavities are in these areas of designation. Just behind the nasal cavity is the nasal pharynx. Just posterior to the oral cavity is the oral pharynx. And posterior to the larynx, not pictured here, would be the laryngeal pharynx, all of which is innervated by cranial nerve 10, the vagus, and the pharyngeal branch of cranial nerve 9, the glossopharyngeal nerve. The pharyngeal constrictors are the superior, middle, and inferior constrictor muscles. Now, muscles of the oral cavity, we want to go to this model, are the lips, and the lips create a bilabial seal, or closure for phonation of the plosives. If there is a genital condition of a cleft of the lip, an impairment that will affect the ability for the lips to close, and often the cleft can include the alveolar ridge. It can cause a malfunction in the dentation, so that closure for proper articulation of bilabial and labial dental sounds would be affected. The muscles here, the orbicularis oris, right around the lips, are superior branch and inferior, and it's a major muscle of the lips for speech and innervated by cranial nerve 7. It originates and terminates at the corner of the lips, and it contracts to close the lips for bilabial phoneme production and for bolus hold. The buccinator here originates at the pterygomandibular ligament and inserts into the orbicularis oris from the buccal branch of cranial nerve 7. It moves food onto the grinding structure of our molars. The risorius is innervated by the buccal branch of cranial nerve 7, and it retracts the lips at the corners. It originates here from the posterior region of the face along the facial of the masseter to the orbicularis oris. The levator labii superior is innervated again by cranial nerve 7. It elevates the upper lip. It originates from the intraorbital margin of the maxilla to the midlateral region of the upper lip. The zygomatic or zygomaticus minor originates from the facial surface of the zygomatic bone to the midlateral region of the upper lip. And then lateral to that is the zygomatic major, and it inserts into the corner of the orbicularis oris and originates on the zygomatic bone. It elevates to retract the angle of the mouth. The depressor labii inferior originates at the oblique line of the mandible and inserts into the lower lip. It dilates the orifice by pulling the lips down and out, again innervated by the mandibular branch of cranial nerve 7. The depressor anguli oris originates from the lateral margins of the mandible on the oblique line and inserts into the orbicularis oris and upper lip corner. It depresses the corners of the mouth and helps compress the upper lip against the lower lip, right here. The levator anguli oris, not included in the model, originates at the canine fossa of the maxilla and inserts into the corners of the upper and lower lips. Again, innervated by the buccal branch of cranial nerve 7, it draws the corners of the mouth up and medially. And then finally, we have the levator labii alicae nasi superioris. It originates at the frontal process of the maxilla, inserts into the midlateral region of the upper lip. It's innervated by cranial nerve 7, and it serves to elevate the upper lip.